normal spine. If spine is like this C shape, okay, this side is convex, this is concave, okay. So now what is important is concave side we have to strengthen. Sorry, convex. This is convex. Convex side we have to strengthen. Concave side we have to stretch. Okay. So usually it is C shape. Okay. Thoracic, cervical, lumbar, sacral. So scoliosis can be there in cervical, can be there in thoracic, can be there in lumbar. Okay. So the convex side we call it as, which side is convex? Right. We call it as right scoliosis. If convex side is on left side, we call it as left scoliosis. So whenever you are saying right or left scoliosis, you should take consideration of convex side. Okay. So 90% of scoliosis is in the thoracic region. Most of the scoliosis in the thoracic region, and most of the thoracic scoliosis towards right. When I say right scoliosis, the convex side is towards right, concave side is towards left. Convex side we have to strengthen, concave side we have to stretch, which is very, very important. So this is basic idea. So if the curve is greater than 10 degrees in coronal plane, then we call it as scoliosis. Okay. There are two methods of treatment. One is surgical and next is non-surgical. In non-surgical, we'll do exercises and we'll use some kind of orthotic management. Whereas in surgical, we'll use spinal surgery like spinal fusions, okay, posterior spinal fusions, or use some kind of rods surgery. We'll put rods inside the spine and we'll make it straight. Harrington's rods, there are different types of things. Today I'll talk about non-surgical management, which is exercise therapy. What are the exercises we can do for the patient with scoliosis? First, one of the important things, we'll start with stretching exercises, which is very, very important for the scoliosis patient. Please turn this side. Okay. So, let's go. So, when you want to do stretching exercises, simple stretching exercises, okay, I'll just show on myself. Okay, so we can take the hand up. One of the important things when you are doing any kind of exercises, you should keep doing breathing. We should not stop. Understand what I'm talking? Take deep breaths, inhale and exhale when you come out. Okay, same thing. Take deep breaths when you come out, exhale. So one of the important things is that when I am doing like this completely, it is stretching here. Understand what I'm talking? So it is very, very important. You have to completely stretch. The same thing, trunk rotations are very, very important. Keep your hands up, take deep breath and exhale. Understand what I'm talking? And take your hands up. Okay, the same thing, rotate towards the left. So trunk rotations and stretching is very, very important. In fact, even we can stretch by putting the hands down. Put the hands down. So what happens? So the spine will get stretched. Understand what I'm talking? So these are some of the simple stretching exercises for the spinal muscles, which is very, very important. So one of the important things we can do stretching using bolster, using physio ball, or even you can using pillows. So I'll show you some of the stretchings using bolster. Give that bolster. Okay. right side. So consider he's having scoliosis on the left side. So when I say left side scoliosis, the convex is towards left side. So we have to give stretching force on this convex side. So I'll ask the patient to lie. Yes. Lie on the bolster. Yes. Up. Yes. Put your hand. Okay. Put your support this. Okay. So if you take your hands up, stretch. What I'm talking. So left side. Sorry, is right side, right? Okay. Left side is having scoliosis. Okay. Convex side is towards left side. So right side we have to stretch. Okay. So like this we can have to maintain stretch for 20 seconds to 30 seconds. Understand what I'm talking?
Sorry, the 50 left side. Why is one left?
He's having scoliosis on the left side.
Left side.
When I say left scoliosis, the convex side is towards left side. Whichever convex side, we should say that side scoliosis. Concave side is towards the right side. Convex side we have to strengthen. Concave side you have to stretch. So he is having scoliosis on the left side. So left side I am giving pressure to make the spine straight, spinal mobilization and thoracic rib cage mobilization. So what I will do, I will put the patient on the left side. I will stretch the right side by this. Understand what I am talking?
Yes.
At least we will maintain for this for 20 to 30 seconds. Okay. The same thing if we can do by using pillows. Okay. Pillow should be S6. Okay, we can put 2 more pillows. Look that's it, please. We can put 2 more pillows. Okay, so we can stretch like this. Okay, same stretching we can do on the physio board. Come on. Yes, I know. Sideways.
Nice.
Okay. Yes. So the same exercise we can do on the physio board. So basically we are stretching. Understand what I'm talking?
Yes.
So please get up. Okay. So important thing, we have to stretch on the convex side. Okay. Whichever side, convex side, that side is scoliosis. That side you have to give strengthening, the opposite side you have to stretch. So stretching is very important. Once we do stretching, then we have to do strengthening of the muscles, the core muscles of the spine, core muscles and spinal stabilization exercises. So we have to concentrate on trunk exercises and pelvic exercises. I'll show you some of the exercises, supine and supine. Okay, bend your legs. Bend, no, hold. That also. Just hold the pillow. Okay, tightly. No. Okay. Now I'll be asking the patient to lift the pelvis up, lift the pelvis up, still up. Okay. So he has to maintain the pelvis for 10 seconds. Okay. So basically we are concentrating on hip muscles, hip extensors, okay, and back extensors. Okay. So we are putting it down. One of the important thing when you are doing any kind of exercises is the patient should keep breathing. Okay, patient should not stop. Okay, because of scoliosis, what happens? Main problems are pulmonary dysfunction and back pain. So it is very important. We have to do respiratory exercises like deep breathing exercises, thoracic mobility exercises, and chest expansion exercises, which is very, very important. That is the reason whenever you are doing any kind of exercises for a patient with scoliosis, we should ask the patient to take deep breaths, inhale deeply and exhale out completely. Okay, so one exercise is bridging. Okay, the same thing. Okay, put your hands. Okay, now we have to ask the patient to do abdominals. A little bit come up. Yes, down. Hand should be extension. Yes, come up. Yes, yes. No, no. Hand should be like this. Yes. Okay. Okay. Come down. Okay. This is for 10 repetitions for abdominals. Now we have to do for obliques. Obliques, come straight. Come up. Go right. Yes. Again, come straight. Okay. Go back. Okay. So we have to do for obliques, right obliques and left obliques. One of the important thing, when the patient is coming up, has to take deep breaths. When the patient is going back, they have to exhale out. So this is very, very important. So we are concentrating on abdominals and oblique muscles. Okay. In prone line, we can do back strengthening exercise for erector spine. Can you move them? Okay, back extension and no here. Yes, come up, up, down, come up. Okay, come down. Okay, so this exercises we have to do for back extension. Then come to quadruped. Come to all fours. Quadruped. Come on. Yes, like this. There are few exercises like cat and camel exercises. Okay. What is cat exercise? You look up and bend your pelvis down. I mean down. Yes. Look up. Okay. So this is cat exercise. Camel exercise. Come down and take your. Understand what I'm talking?
Yeah.
See, camel means when he takes head down, his spine should completely, it should be flexed up. Cat exercises when he is looking up. Yes. Understand what I'm talking? These are the exercises which strengthen the. But these exercises will come in level 4, level 5. No. Cat and camel exercises are very, very important for the spinal muscles, core stability exercises. Okay, so this is one exercises. Look up. Other exercises: take this hand up, one hand up. Okay, and take this leg back. Understand what I'm talking?
Yes.
These are one exercises which strengthens. Okay, and the same thing opposite. Take your hand up and this leg up. Understood? So these are some of the exercises where we can do for the patients with scoliosis. Understand what I am talking? First, we should stretch. Next, we have to strengthen. And next, we have to concentrate on respiratory exercises. Okay. Respiratory exercises, you should concentrate in all the exercises. Cat and camel, strengthening, abdominal exercises, stretching. In all the exercises, you have to concentrate. So these are some of the important exercises for patient with scoliosis. Along with, after once he has become better, even we can concentrate on balance exercises. Stand. Balance exercises. One leg standing. Understand what I am talking? Okay. Like this, walking in straight line. Okay. So these are some of the balance exercises where we can do for the patient with scoliosis. So these are some of the simple exercises where we can do for patient with scoliosis. So there are some orthoses commonly used for scoliosis. What are the orthoses in area? You might be having exam today. Yes, name some 2-3 orthoses for scoliosis. First is Milwaukee brace, Boston brace, thoracolumbosacral orthosis brace. Okay, these things are important. Understand what I am talking? These things are important. So I will be asking exams. What are the braces and orthosis used for scoliosis?
Boston. Brace.
Boston brace.
Boston.
So what I'm trying to say is that in practical exam, I'll be asking how to stretch a patient with left scoliosis, how to strengthen, and I forgot one of the important thing, to strengthen the lateral flexor, side. Any side. No, good. Which way is? Yes, come on. Side. Yes. Completely. Okay, good. Okay, basically we are strengthening the side flexors. This hand should be like this. Okay. Come on. Side, yes. You should take the hand up. Like this. Come up, come down. No, without hand you should come. Yes. Yes. Go down, yes. Okay, it's a little bit weak. Normally, you should come up side flexion. Okay, so it strengthens the side flexor muscles. Okay, so you have to concentrate on stretching, strengthening, respiratory exercises, which includes deep breathing exercises, thoracic mobility exercises, and you should know what is braces, which are common braces used for management of scoliosis. Okay, if the curve is greater than 25 degrees, then you should go for surgical procedures. If the curve is less than 25, then you have to manage with exercises and with braces. Okay, these are the simple exercises. I'll be asking what stretching exercises, how we can do on the bolster, on the ball, on the pillows, what are the strengthening exercises, okay, some balance exercises and braces commonly used for the scoliosis in the practicals. Okay, any queries, any questions? 6. So there is one more simple topic which we call it as congenital muscular torticollis. What is torticollis? If patient is affected with right side, what is the posture?
Left side.
Right side problem. In congenital muscular torticollis, important muscle involved is sternocleidomastoid, unilateral sternocleidomastoid. If right sternocleidomastoid is involved, what is the position? The head will be flexed towards this side and it will be rotated towards opposite side. Understand what I am talking? Shabab, please look here, this is important. If your patient is having right torticollis, torticollis means involvement of sternocleidomastoid muscle. Okay, if right side sternocleidomastoid muscle is involved, the head will be flexed towards the same side and rotated towards the opposite side. Usually it happens in younger children, infants, neonates. So what is the physical therapy management for these patients? Basically we have to do passive and active range of motion exercises for the neck, and we have to do stretching exercises for the neck, and later on we have to do strengthening exercises for the neck. Now I will be teaching how we can do passive range of motion exercises for the neck. It's very simple. So passive range of motion exercises is very important. Okay, so slowly we can take to left and towards right. Okay, and slowly towards flexion and extension, and even we can do rotations. Okay, towards the right and towards left. So these are some of the simple passive exercises for the patients with torticollis. One of the important thing is that we have to stretch the muscles, neck muscles, which is very important. So in torticollis, say example, the right sternocleidomastoid muscle is involved. So it will be flexed towards this side and will be rotated towards opposite side. So what we should do, one of the important thing, we have to stretch. How we can stretch? We have to put one hand on the shoulders and other hand on the neck, and we have to stretch like this. Understand what I am talking? Okay? And the same thing, we have to stretch in the opposite side. Okay? And the same thing, okay? Make sure that, okay, is okay. These are some of the stretching exercises where you can do for patient with torticollis. Okay, so once this is finished, okay, we can do active exercises. Active exercises means even we can do on physio ball. Okay, even we can make the patient sit, a baby sit. We can ask, usually we can ask the kid to look at this side, put some toys or something, so that automatically what happens, rotation towards left right will happen. Okay, so these are some of the things where you can encourage for the patients. Even we can, when we are lifting and carrying also, we should be very important. Say example, this kid is having torticollis on right side, so we can hold the kid like this. Okay, even we can stretch. This is what I am talking. So next stretching is very important. So next is how to strengthen the muscles. Please you can do. So I already have taught you have to stretch like this. Okay, and even once you do like this, okay, next is we have to flex both the sides. Okay, even we have to stretch the neck muscles on the both the sides. And one of the important thing is that even we can facilitate rolling. Okay, when you facilitate rolling, automatically they have to use the neck muscles. So automatically neck strengthening will happen. Even you can put the baby on prone line, forearm on elbows. Okay, ask the kid to look up and towards right side. So we are facilitating and we are strengthening the neck muscles. Even the same exercises can be done on the physio ball. Okay, physio ball. We can put the baby prone line. Okay. You can take the baby prone line. Okay. Put the baby on forearms. Okay. Look towards. Get the head extension and look towards the right side. Okay. So like this we can strengthen the muscles for the neck. Okay. So these are some of the two important conditions: scoliosis and torticollis. You have any queries, any questions? Any questions, any queries? Any doubts? No? Okay, thank you.